Welcome, everyone. So glad that you all are here for this One Health um, lunch seminar. Uh, we are really happy to have with us T. Fisher, who is going to be presenting about her work. And the title of her talk is Advancing One Health Systems for Pet Families and Communities. Um, so I'm going to go ahead. I get the honor to introduce T today. And I do want to let you know that we will be having the presentation for about 50 minutes, and then there'll be questions and answers at the end. Feel free to put your questions and answers in the chat, but we will visit those when T has finished her content for the day. So, T. Fisher is the Director of Operations for the University of Tennessee's Program for Pet Health Equity, where she provides strategic, operational, and communications leadership to advance equitable access to veterinary care through a One Health systems-based approach. Her work focuses on strengthening the interconnected health of people, animals, and communities by supporting cross-sector collaboration, community-engaged programs, and workforce development. With more than 20 years of experience spanning animal welfare, shelter medicine, and public health aligned initiatives, T has led nationally recognized programs that integrate veterinary medicine, social science, and community partnerships. She previously served as the Vice President of Animal Welfare at the Houston SPCA and as founder and program director of the Companion Animal Initiative of Tennessee. And I want to add just a little bit of personal information about my knowledge and connection with T. I met T in 2002 at the College of Veterinary Medicine, and at that time her hat was formally as a graphics artist. But what I have come to learn about T over the years that I've known her is that she is a dedicated, focused, creative, determined, and perseverant person. And so starting at the veterinary college back then, we were in a class, one of the first ethics classes on animals with John Nolt, and Catherine Faber in the College of Social Work. And from that time on now, she now sits as the Director of Operations for the Program for Pet Health Equity at the College of Social Work. So long trajectory of animal welfare advocacy and dedication to that mission. And that has been honored by receiving the Animal Welfare and Humane Ethics Award from the American Animal Hospital Association, and that is just one of many accolades that T has had over the course of her career. So, with that being said, we'll turn it over to T. And T, if you need anything as we're moving through, just holler out and I'll do my best to help you out.
Thank you, Elizabeth. Thanks everyone for joining us today. Hopefully you can hear me and everything is good. I'm going to go ahead and share my screen. Hopefully. Oh, wait. Share. There we go. Can you see that? Perfect. And as Elizabeth said, please put your questions in the chat, but I'm not able to see the chat. So Elizabeth will hold them for the end and hopefully we can answer them as we come along. So today's topic is advancing One Health. And as she said, I'm T. Fisher. That QR code just takes you to my contact information if you'd like to reach out and connect. So why One Health and pets? What's the connection there? So humans, pets, and their community are deeply interconnected. Our pets influence physical health, our mental health, even our housing stability and recovery. A lot of folks can or cannot get into homes because they have pets and they're not going to leave their pets. So housing stability is really crucial right now. And then the veterinary access, which is so important and part of the One Health systems. How we define family has changed over the years. Our society has gone dramatic changes, especially during and after COVID. How we define family changed. These bumper stickers are becoming more and more common. and terms like fur baby or pet parents are more and more accepted. Evidence of this is seen all over in new products and services that are available for the public. We now have car seats or strollers for our pets, even pet facilities that take care of them for daycare. So the bottom line is that we're currently in a bonded family society. Families are defined by both human and non-human members, and then they're in a bonded relationship. And as many of you may or may not know, around 66% of the households in the United States have pets. Only 40% have human children. So the data also shows that in 97% of those households that they believe that that pet is a member of their household. So this phenomenon is not going to change, as millennials represent the biggest share of households with pets. And bonded families exist across all socioeconomic spectrums. So about PPHE, the Program for Pet Health Equity. We are housed at the University of Tennessee. Our mission is to advance pet family well-being by transforming fragmented systems into integrated, community-driven One's Health systems. And our approach is through research, education, and partnerships. So we use a four-sector framework for our work that provides a comprehensive framework for integrating human and pet well-being across these industries. By recognizing the interconnectedness of pet families and essential support, it collaborates folks together to help make changes. So the four sectors, economic and community support, this ensures financial and community support is accessible for our pet families. So it may be banks and financial institutions, our grant makers, our foundations, employee work and wellness programs. So some promote pet-friendly policies that benefit the employees. Our community health organizations and our NGOs helping with financial or logistic barriers to pet care. Maybe it's the folks don't have a way to get their animal to the vet. Pet or faith-based and civics groups also fall into that, as well as food banks. More and more food banks are noticing that they need pets food for their folks as well. Our health and well-being sector focuses on veterinary and human health care to promote the well-being of both. So those are our vet clinics, our animal shelters, our medical and mental health care providers, our public health department. Then as we move to our housing and transportation sector, it focuses on removing logistical barriers that prevent families from keeping and caring for their pets. So that may be pet-friendly housing advocates. As I mentioned, housing is crucial right now, and where families can go for housing for them and their pets. The public transit folks, so again, being able to get them to the vet. And then the education sector. So it ensures long-term stability through research, education, and policy. So there we're looking at our vet schools, our medical schools, our think tanks, policy research. And I apologize, my slides are advancing without my permission, so I'm not sure what's going on there. No? Okay, and it's just going to forward on. So One Health, these are our strategic priorities, our One Health community that I'm going to talk a little bit about, our Journal for One Health Systems, our One Health Systems Summit, and our education. And I'm not sure. Okay, and our research and evaluation. So here we go. So our One Health community, it's a public forum in collaboration with us, the University of Tennessee Program for Pet Health Equity and Maddie's Fund. It's aimed at enhancing efforts across the full spectrum of care for individuals and their pets. Our missions to champion and streamline national cooperatives, initiatives, shape public policy, and dismantle obstacles for healthcare for those pet families. Why it matters, we're breaking down those professional silos and getting folks to work together, and we're supporting shared and learned innovations, and then we're building momentum for change. So, and those QR codes can take you to join. So, here we go. Okay, so our One Health initiative. I do not know what's happening to my slides, I promise.
Hey, T, do you want to just stop for a second and reshare and just try to see if we can reset it?
Maybe. Let's see. Let's go back to where we were. Okay. hopefully nope, it's just whizzing on through. Okay, well, how about we do this? Huh, not sure. Let me real quick
Sure. Take your time, T.
check all this, check all our animation off of it, maybe. No. Okay. Well, there's our stopwatches we see. Okay. I'm not sure why it's doing that, but let's do that. All right. Sorry, everybody. I don't know why these timers are here. I apologize.
I think that's a really good idea, T, to present it that way if you're comfortable.
Okay, that sounds good. As
Yeah,
long as everybody can see.
I
Okay,
think
great.
you can see. Yeah, I think that was a good idea on your part.
Thanks, Elizabeth. Okay, so our One Health Education Initiative, we're working on skills in animal welfare, preventing or promoting mental health and the well-being for our professionals. So working on their communication skills as well as what they're going through. So the modules, some of them focus on people skills, helping the staff feel more welcoming, more engaged, able to talk to these families. As we see they're we need knowledge in our shelters to help our families and help those communities. So as you can see, some of our modules are mental health within the animal welfare profession, building resilience, effective communication for staff and families, how to communicate in a family crisis, how to support a family in a crisis, and then addressing biases in the inclusion in animal welfare and grief and bereavement. Our folks, our staff in animal shelters every day go through grief. It may be because of the animal that they've taken in and helped to take care of for so long that they had to say goodbye for natural reasons or because they went to foster or because they got adopted. But a lot of grief happens in our shelters, and we want those people to be able to help digest it and excel from that. Let's see. Next. Okay, so our One Health Systems Summit, we're really excited about this. Our first summit will be in 2026 at the APHA Annual Meeting and Expo. It's designed to move theory into action. So it's going to be a pre-conference workshop. The summit convenes leaders in pet and elk and health equity for people and pets through their collaboration, policy, and research. The diverse community represents the spectrum of expertise needed for the pet health equity. Here we go. All right. As I said, the first one is going to be this year, not next year, this year, October 31st in at the Henry Gonzalez Convention Center, along with APHA's annual meeting. We will have a social event and reception, but there'll also be a pop-up clinic, and I think a couple of you folks who are on here today are involved with that. So thank you very much. That's very exciting that we'll have this pop-up clinic. Our partners in that are the One Health Clinic, University of Washington, and the Street Dog Coalition. So we're excited about this. Another thing we're excited about is our journal. So our journal for One Health Systems. We're launching an open access peer-reviewed journal, the One Health System Journal of One Health Systems, recognizing companion animals are essential members of the family. It synthesizes perspectives so that care systems include veterinary care, human care, public health, social services. They can all be aligned. Economic and infrastructure policies to support those things, and the well-being of pet families. So it's on a COPE-friendly foundation, and we're aspiring to move for future indexing. We're running a private call for papers right now with plans to publish our first issue this year. And we will be launching a big public call for papers. So please reach out to us and let us know you want to be on that list. Our PPHE research, this is a big, strong pillar of us, is our research program. Conducts interdisciplinary research to understand and strengthen the relationship between people, the pets, community. We're looking at veterinary and behavior care, the human and animal bond, and the role pets play in human health, recovery, that social connection that we have. By integrating all of these things, we hope to build a One Health aligned approach that delivers pet family well-being to all members of the pet family. So, our research areas that we're focusing on most heavily are access to care and services, pet family support systems, and then our pet family well-being. So here's a couple of ways we've done this so far. These QR codes will take you directly to these reports if you're interested in reading them. So hopefully you are. But first report, access to veterinary care, barriers, current practices, and public policy, was in 2018, and it was just really understanding the barriers to care that a lot of our pet families face, but also the veterinarians themselves. How are they able or not able to help folks access veterinary care for their family member? So, as always, after the pandemic, we did the report again. This time we focused only on the family side of it. Barriers to care, looking at their vaccination statuses, microchip status, spay-neuter rates, and looking at all of those and the family's income, where they were in the areas, their age groups. So we did see a couple of trends changing. The average pet house pet per household decreased from 2.2 to 2.0. Nearly half of the households only have one pet now, and there did seem to be a preference for dogs over cats. But the likely drivers are the urban living or their financial constraints, or many of their life changes that are going on and that we can't accommodate. We couldn't um, ask about in our survey. So in our recent report, Barriers and Insights from Those Pet Families, we looking at cost is remaining the top obstacle for our families. Logistical issues, so maybe they again can't get their pet to the vet, or maybe they can't get there in time because they have to work, they have to pay the bills. And it's even growing even in our higher income households. So that's, it's not just poor folks, it's everybody who's having an issue, or lots more people are struggling to get their pet to the vet to be seen during the hours that they are open. So some of that could be because of the vet shortage. Some of it could be because the clinic is just too busy. During COVID, we saw a lot of clinics who saw them kind of at a drive-through service. And so business picked up, if you will, but maybe our folks can't get in during the only hours or the only times that they have available. So how can we help those families as well? We know that by not getting our animals to the vet, that's going to likelihood of pet surrender or euthanasia for medical reasons. That really wears on everyone, not only the pet family, but the folks who are administering the euthanasia. Economic euthanasias are never something that you want to have to do. But yet our veterinary teams and our support staff they have to do that for the best care and interest of that pet and that family. So how does that weigh on their mental health as well? Um, we also looked at increased stress reporting among households. So we know there's a high demand for training, and we know there's a high demand for behavior training. We know that older adults need care, a lot of times foster care. So even not older, but folks who are going into the hospital that need treatment or that need a surgery, they're not going to do it because they can't go into the hospital because no one will take care of their pet, their family member. So how can we help those people get access to care for themselves as well? Um, and then we're looking at expanding access to care. We're looking for stronger support systems within the community to help rectify those things. So, okay. Access to care and services. So, access to behavioral care. We know that behavior is one of the top reasons animals, cats, and dogs enter our animal shelters every day. So, we're looking into understanding who provides and who receives dog training and support in the United States. If families are adopting from the shelter, does the shelter help them with behavior questions? Does it offer them support or training? Wherever those animals are coming from, how are the humans learning to take care of them and best train them to fit in this human-centric environment? A couple more of our reports that we've worked on are access to care and services, looking at access to care and welfare and animal welfare organizations. So the purpose of this study was to better understand the challenges of animal welfare organizations that they face around access to care and animals while they're in their care. Maybe it's the resources, maybe they need more resources, maybe folks don't even know that they're there. So how can we help them better help their communities? Racial disparities in animal welfare. This one we worked on, we're just looking at how pet adoptions and procedures may impact different groups, different racial and ethnic groups in society, within communities, and what the differences are within a community, how it impacts policies and procedures of animal control, animal welfare organizations, things like that. Okay, our pet family support systems. So while animal organizations often provide direct services, social service agencies are really the first point of contact for a lot of families in crisis. We want to be able to help those social service agencies even identify that that is a pet family and that other options and resources that they could provide to those pet families. So, emerging evidence in small case studies and pilot programs shows that human organizations assist clinics with pet food or housing advocacy, working on temporary care, so foster care again, maybe while those folks are having to go into the hospital or to receive services they need for themselves. Um, these efforts are often unfunded, so that's a struggle. And then it's really left up to the individual staff person to know. So we want to be able to, all of our social service agencies, to have folks understand that we are a pet family, we're a bonded society now. And so when you're looking at the person, you also need to think about all in a holistic approach of, well, maybe they're stressed out because their pet needs health care. Maybe they're stressed out because they can't feed their pet. And we know that most people are going to feed their pets first. So again, that affects their health care. So we want to be able to provide and help our social service agencies understand how important these pet families are and how they can treat them holistically or help them holistically. So this current study is designed to fill the gap based on existing research and 10 key interviews. We developed a survey on the types of, and you can see it down there, the types of programs and services they're delivering, the barriers and facilitators to collaboration. So what do you know about the other organizations in your community? How can we connect you so that you can work together? Um, Programs are most compatible with pet inclusive or One Health approaches. So again, if you're helping that family with housing, you need to know that they have a pet as a family member and they're not going to leave their family member behind. So how can we help them secure housing for their entire family? Um, so these findings will establish a baseline for how service agencies currently engage with companion animals and their families and help them provide those services even better, hopefully. Okay, here we go. So pet family health and well-being, looking at the different dynamics of that human-animal bond, how the relationships impact families. So understanding the roles that pets play, whether that's in substance abuse recovery or senior well-being or with our veterans in the community. We know that a lot of our veterans have animals that help them. Um, with their daily activities. So we need to know the circumstances on how they can access care or why they can't access care and how we can again get those professions to work together to help that human family member. This is when we're talking about substance abuse and recovery. Marvel Way is in Reno, Nevada, and it was our first project looking at substance abuse and recovery. They offer permanent housing and sober living community for folks. The conditions that folks must meet are they have to graduate from a substance abuse recovery program, maintain sobriety, and meet income eligibility to live at Marvel Way. So we did a lot of research with them. We are continuing, but what we found is nothing uncommon, nothing that we wouldn't suspect. Our pets are unconditional love. And you see there from a case manager and a quote from a case manager, and also another quote from our resident with pets. Just our resident. I lost my best friend, and if I didn't have my dog to come home to, I don't like where I'd be at. Just having that unconditional love, it's like really life changing. I think we can all relate to that on those bad days when we come home and that furry family member is ready to greet us. Sources of joy. So as you can see from our residents with pets, this is a huge factor. The check-in survey that we did asked participants to scale on a scale of 1 to 10, 1 being the lowest and 10 being the highest, to indicate how much joy they experienced that week. They were able to ask and use the same scale to indicate how much joy they experienced with their pets. So we found that the joy experienced with their pet exceeded the level of overall joy. So 6 out of 10 times, the respondents shared specifics about what brought them joy, and that was their pet. So we know those pets are vital to these folks in recovery. They're not only a source for joy, but also joy to the folks who don't have a pet. So, a couple of quotes from folks who don't have a pet. I helped walk them. I enjoyed them very much. I get a lot of pleasure out of petting others' cats and dogs. Another resident said, children come out and just light up when they see them. So again, those pets are even helping folks who are not their family members, by engaging and getting them out and getting them interested and getting them involved with other people. That's helping the mental health for both parties involved. All right, so we know it's a conduit for social interaction and building relationships. As you can see there, residents with and without a pet. Pet gives so much a reason to go outside and socialize, especially if they're shy. I don't know if I'd be as connected to the community if I didn't have my pet. I would probably isolate a lot more and go through my anxiety. We know that especially our large dogs, they have to be walked and go outside. So that's getting their human outside and getting their human a little bit more healthy and hopefully a little more connected to those around them in their community. So, impacts of pets on substance abuse recovery. We are full way in our part 2, phase 2 with Marvel Way. We have 13 participants enrolled. They receive a survey about every 2 weeks for 12 months, and then the final surveys will come in this November. So residents and staff focus groups, we're going to hold those in June or September of this year. So our team will go out and help with those. And then this study is actually being replicated in an outpatient setting, and it's funded by the University of Tennessee College of Social Work. So we're very appreciative for that. When we are focusing on this, we are looking at their journey, so their recovery journey, both physical and mental. We ask about pets in the home, how that pet impacts them, what barriers they may face in having a pet, what stressors come from having a pet, and looking at people in that outpatient treatment area for programs to help other folks going through the same recovery. So our seniors, looking at the impacts on senior well-being. This past fall, we did a survey and a focus group, so we're looking at that data. This winter, we're looking at finishing our final summary for a report that we did with Knoxville Community Development Cooperation to conduct a survey at 3 of their income-restricted housing complexes. We surveyed 282 residents and conducted focus groups with 29 people, and without pets participated. So we asked with and without pets. We asked questions related to quality of life, their loneliness, and as I said, we are replicating this study here, and we're looking forward here to the spring to having a few more potential folks for the 2027 study on pets in senior communities and their impact. And those are non-income restricted communities. So we are toying around with the idea and talking with folks from Charlotte, North Carolina, here in Knoxville, Tennessee, and then St. Louis, Missouri. Another aspect that we are so excited about, Frontiers in Veterinary Science asked us to publish Volume 2 under our research topic, Enhancing Veterinary Access Through One Health and Interpersonal Collaborations. We have just closed Volume 2. It was a success. We doubled our amount of articles, so we have 18 articles. We will be publishing an ebook, so all those articles and an editorial will come out hopefully at the end of March of this year for folks. Of those 18 articles that published, there were 83 authors. We've had about 60,000 plus downloads across the world right now, except in Antarctica. But so they asked us if we would like to do round 3 because it was such a success, but we had to decline because we want to promote and fully focus on our Journal of One Health Systems. So let's see, some of the great, I think, great articles that were published looking at access to vet care in Canada, a cross-sectional survey of animal healthcare organizations and interventions. One Health Clinic Challenges and Evolution, increasing access to care for people, pets in rural communities in Northern California. Creating partnerships between vets and underserved producers. So getting to look and establishing that client-vet relationship. Community perceptions on dogs, health risks, and vet care in rural Alaska. So you can imagine how different that would be. A lot of the areas they can or cannot get to depending on the weather, literally, because it may be a road one day and it may be gone the next. So it's very hard accessing veterinary care in our Alaskan areas. Crossing, not so human or animal focused, but looking at physicians' perceptions and understanding of pet ownership and healthcare compliance and patient well-being. So again, looking at taking a holistic approach to treat their patient, the human, they have to take in consideration those non-human animals that are their family members as well. So taking that holistic approach. We looked at one of our articles talks about advocating for incorporating public veterinary health into the human health systems. One of them was from Phoenix, Arizona, bridging gaps in vet care, restructuring a community clinic for cultural inclusion in Phoenix, Arizona. Another study that they did in rural Alaska. So beyond those clinical skills, from the student perspective, what they learned, what they reported. And then we looked, one article is about the Santee Nation, so evolving culturally relevant veterinary care, working with the Santee Nation. So again, our articles are a little bit, again, pet family focused, but all about with the One Health perspective and how we can make things better from the One Health perspective. We are fully engaged. We are at the University of Tennessee, so we are all about training the next generation to take over. This year, we've had 4 students in our fiscal year thus far. You can see that they are all over. Our latest student, she just presented at the CAT conference. If you all were able to attend this past weekend, she presented her work at our the online CAT conference. But again, one of them is helping us with our dog training survey, but they're just really, they're able to assist us with our research, and they're mentored and they're gaining research experience as well as being able to work with other professionals and how to collaborate and break down these silos that our profession seems to want to work in. We are exploring becoming and expanding the bench leaders in equitable evolution and diversity as a host site. So hopefully more to follow on that one. Why does this matter? Again, going back to One Health and Pets, why does this matter? Growing inequities and access to care. So that's human care and veterinary care. So again, logistics, money, language barriers, all of those things. These inequities are growing. So how can we stop that? the rising recognition of pets in health systems. So I can't tell you how many times I was diagnosed with X, Y, and Z at the vet school, only to go to my healthcare professional to say, "Who diagnosed you?" A doctor. So again, we have to be able to look at this health and how we take care of each other and how we take care of our pet families so they can help their all members of their family. This is really good for opportunity for meaningful systems change. We want to break down those silos. We want all of us to start working together for our missions, and that's to health. And how can we do that through that One Health lens? What success looks like for us. Pets are included in health and social services. So how can we do that? How can we make sure that our pets are on the radar for all of these folks to again take care of that human and their family? Cross-sector collaboration, we want that to be normalized. We want folks to break out of their silos, break those professional silos and work together again for a good result, an end product. Um, we all want to work together to be able to do that, but we have to start talking to each other and working together and seeing from those other perspectives on how we can change and how we can make things better for our families. We want our communities healthier and stronger. So again, the majority of our households have pets, not human children. So how can we make that a healthy community? Whether those are dog parks or places folks can go with their animals, we need those to be healthy. And that's definitely looking through a One Health perspective to make sure that the human, their pets, and their environment is safe and healthy for them. So calls to action and how you can help. How are your friend? Call your neighbor. Tell other professional folks in your industries. We encourage you to join our One Health Forum. As we said, we have about 12,000 plus members growing daily, and it's diverse. It was centered on the pet perspective, but now we're having a lot more of our human health drop in and our public health professionals. So they're commenting, when we're talking about cancers and cancers that we see in humans and the dogs, but that's, and in the family and how we can help all those things and how we can cross-pollinate, if you will, to help. So you can participate in research and dialogue. So again, if you just want to reach out to us, let us know if some of this research that we've talked about is interesting to you. Please let us know. If there's other research that you think we may be able to help you with, please let us know. We definitely want to talk to you about that. And then it's really important in the forum that you're sharing what's going on from your community, from your area, because as we said, things in Alaska aren't the same as they are in, Wisconsin. So how do we treat those different areas? How do we help those communities help best help their pet families? We ask you to advocate, so support pet inclusive policies. Perhaps that's like we was talking about homes and housing. How do we increase housing availability to our pet families? Transportation. If their only way to get their animal to the vet is the bus, then let's help and make sure that we have public transportation available to these folks so that they can get their family members safely to the doctor to be seen. We want to champion One Health and your organization. So again, thinking outside the silo when you're talking to your other professionals, let them know about the angles that we need to look at to take care of that pet family and that holistic approach. And hopefully we'll shift toward this equity and hopefully that all of our pet families can get the access to care and essentials that they need. We also, again, ask you to partner with us on research. So just let us know if you're interested. Attend the One Health Summit, and that QR code will take you to the summit page. So whether you're interested in sponsoring or attending, let us know. We'll make sure to keep you on our email list so that we can reach out to you and let you know any updates that we have going on with the symposium, with the summit. And then, maybe you want to present. Either way, just let us know. We're happy to talk with you about that. So That's all I have, but I just want to say that together we are building healthier communities and we are building a healthier society, a bonded family society, if you will. Again, the majority of our households have pets, so we know that pets and people and community, we need to make that a very happy and healthy pet family, and that increases the health in that community. So let's spread the virus, if you will, the good virus. So there's our email for the Program for Pet Health Equity if you want to reach out to us. If any of this sounded great or interesting, or you have any other questions, or you want to talk to some of our staff, please let us know. Our researchers are always interested, and Katie's working on our journal. She'll be happy to talk to you about that. So just please let us know any of these topics that you're interested in, or any of the things that you might want to talk about adding to our plate with you in partnership. So, all right. That's all of that. I'm going to
Thank
stop
you.
sharing.
Thank you, T. Really appreciate your content, and we got a lot of claps. We have a lot of time. Uh, Great time for questions and comments. I did just open the chat so everybody can chat to each other. So feel free if you have anything you want to share or you share your contact information with each other, feel free to put your information in that. And we would love questions. If you have a question, you can raise your hand, and I will also monitor the chat if you have a question you want to post in the chat. Wonderful presentation. Thank you. There we go. Vicky, yes, please.
Hi, Vicky. But I heard from me. Oh no. Katie or Ashley, can you?
Okay, I'm good. I'm good. I'm good now. I was trying to, I think it's you're gonna have to manually do that for each person, I think. Awesome. That was super interesting and so exciting to see it all laid out like that. Thank you so much. Um, I did have a question about the work you're doing in the rehab setting. Wondering if you are looking at length of sobriety in non-pet owner residents as well, just to as a comparative.
I'm trying to see if our researchers are on here. Claire, yes. I'm going to ask Claire to unmute.
Yes. So yes, we are. So for our recovery studies, both in sober living and outpatient, we are comparing people with pets with people without pets. And then one of the questions we do ask is how long they've been in the recovery journey. Um, though recognizing that, that might not be as straightforward question for everyone, but to your point, we are comparing it with people without pets.
I saw that in the elderly studies, but not awesome. Thank you so much.
Thank
Very
you.
fun.
So we have a question that came in. With the growing costs of veterinary care, what is your plan to pay for all of this?
That's where collaboration and working together takes place. We have folks who, the veterinarian, I can't believe you charged $10 for this vaccination. Vets just want to make so much money. I've taught at the vet school for our College of Veterinary Medicine for 20 years. I haven't met a rich millionaire veterinarian, self-made yet. They're not in it because they want to make tons of money. They're just trying to pay overhead and costs. And we know that those costs can be different, even here in Knoxville, Tennessee. On one side of our county, a spay could be $20. On the other side of the county, it could be $200. So again, that's collaboration and working with folks. So not asking veterinarians not to be able to pay their bills, but how can we get other subsidies? How can we work with other organizations? How can we work with nonprofits to help subsidize it? Preventative care is huge. So again, getting to those animals before they're sick. How can we help those pets not get sick? Preventative care is most of the time, all the time, a lot cheaper than taking care of them after the fact. So again, that's a lot of working together. We have a lot of pop-up clinics happening, and they are working with a lot of grantors, a lot of folks who just want to help. So that's volunteers coming to help. That's our drug companies giving donations and all things like that. So collaborating together, we're not saying that, yep, you've got to pay this one bill for everybody. When we started Align Care, which was our service program, which is its own nonprofit now, we looked at different ways on how to help folks and how to help them pay. We found a lot of folks, they would pay what they could. They didn't want things for free. They wanted to be able to help, and they wanted to be able to help their family. Well, one of our families, she was even giving $5 a week after she paid her bill because she knew that she was going to have to get insulin the next month. So again, it's just reaching out and partnering with other agencies to afford all of the pet care and even the human care that is needed to keep that family healthy.
Wonderful. T, there was the question of where is the summit being held, and it's worth just saying there's an answer that came in the chat, but I think verbally
Sure.
it's just worth saying again. I guess San Antonio, Texas.
Yes, it's conjunction with the American Pet Health Association's annual meeting and expo. This past year at the APHA expo, two of our folks attended, and so we had a little discussion, well, a meeting to discuss this upcoming summit and what all it was entailing. But also, it was a great chance for some of our folks to meet other public health professionals and tell them about these things and talking about pet inclusive housing or pet inclusive everything and being able to reach out to those pet families. So the summit will be the day before the APHA convention starts. And so it's scheduled currently for San Antonio, Texas. Thank you.
Yes, and nice that Vicky also just noted that at the One Health Clinic pop-up is a collaboration between the University of Washington and Washington State University College of Veterinary Medicine. Just pointing out collaborations are key. Yeah.
Vicky, would you want to say a little bit more about that? Because I didn't want to call you out as the inspiration, but
Oh no, I saw that it said University of Washington on the slide, and we really make sure that we like list everyone that helps. So I just
thank
didn't want
you.
it to look like just us.
Thank you.
Yeah, no,
Did you want
thank
to tell them
you.
a little bit about what's going to happen at it for folks who don't know?
Yeah, so the intent, so the One Health summit that's occurring before the American Public Health Association APHA meeting. Um, so that's going to happen the day before the APHA really starts. And then the day before that, we are intending on doing a half day One Health clinic in collaboration again with Street Dog Medicine, Street Dog Veterinary Outreach, as well as we think it's either going to be at an elderly transitional housing unit or a homeless emergency shelter. So we're still trying to figure out what's happening there. Anyone who's interested will register for participating in that pop-up clinic, and then there'll be hands-on experience on how to set this one up in your own communities. We also are trying to define like how many people will be able to register for that pop-up event.
Hmm.
Sorry, Vicky, can you speak again? I don't know why it all of a sudden got quiet.
Let me see.
There we
Can you
go.
hear me
Yep,
again?
we just
Okay.
got you. Yeah.
Yeah, so
Sorry.
it's still very, very new, but it's gonna if there's any Texas vets who want to be involved providing veterinary care, there'll be that opportunity. If there's out-of-state vets, they would be allowed to do like vet techie, vet assistant kind of things, since they can't practice in state. But then public health, social workers, there'll be roles for everyone within that pop-up event.
So exciting.
Nice. So in the chat, we also have maybe everybody can just do a shout out. Insightful presentation. I'm from Mombasa in Mombasa, Kenya. We are currently using a similar approach as rehab for seniors and communities with companionship and with delinquent teens from dysfunctional families as pet therapy. So happy to see from this presentation that we're on the right track. Everybody can give a shout out and a high five on that. And as a reminder, if you have a question, feel free to raise your hand. And we will give you an opportunity, of course, to verbally ask your question. But we do have one in the chat that says, what advice do you have? This is from Chelsea Pierce. What advice do you have for effective collaboration across sectors and getting non animal groups to be interested in issues affecting pets and their people?
Um, hmm. That is interesting and a challenge, but it's a good challenge. Um, I can remember back in my days at the vet school when I was running a feral fixing program, and that caused controversy because of, our wildlife and this and that. So when I was able to bring those folks together for a common good of less community cats, um, it's really getting them to think outside their biases. So I think the same is important here. I'm getting non-pet people to see the problem, to see what's happening. Whether you like pets or not, or acknowledge them or not, doesn't matter. 60% of our households have them. That's a fact. Only 40% have human children. That's another fact. So getting those folks to speak outside of their box, again, if they're looking at their challenge, their problem, you have to look at all aspects of it. And again, reaching out to those folks who do know about animals, do know about pets, do know about taking care of them is the best way for you to reach your mission. We are happy. I love collaborating with people or just getting people together, just cross-pollinating, if you will, to get folks to play together. A lot of it is in you're delivering the same message, but it's in the way you're delivering it. When we're talking to folks about pet licensing or rabies vaccinations. It's not about helping, when we're talking to civic leaders, it's not about helping that dog not get rabies. It's about helping the community not get bitten by the dog that has rabies. So it's all about putting it back, trying to help them overcome their biases, but also open them up to understand that this is one health. We all share this rock, and we all need to be inclusive in how we're helping treat that family.
Wonderful. Okay. Um, oh, Claire, do you want to verbally share or?
Sure. Yes.
Okay, that'd be great.
Yes. So I just put this in the
Claire,
chat as well.
sorry. Claire, introduce yourself first, please.
Yes, sorry. My name is Claire Stuch, and I am the Associate Director for Research for PPHE. And T did a fantastic job of explaining, all the different projects that we have going on. But I did want to highlight, we don't have, direct involvement with them, but Greater Good Charities and Red Rover have this initiative called Don't Forget the Pets. And we met with them to learn more about the work that they're doing, but it's very exciting, and it's exactly of this work that Chelsea was asking about. How do you get these the human-centered groups to be aware and be inclusive of pets? And so I think a lot of times, it's like it's just not on people's radar, and and then there's like, okay, well, it's intimidating because now all of a sudden you have a whole new species with that, and resources are usually already really spread thin. So they provide the support in terms of information that you need, the design, if you have any kennels. There's like the construction support, there's information about the policy and procedures that you might need to have in place. And so I think they're a really great example of how to do this work. And then hopefully in the social service agency study that we have just launched, we'll be collecting some great data that helps us gain a little bit more insight into what is hindering effective collaboration at the moment. So is it more getting leadership on board? Is it more this, I don't really have the information or the infrastructure? Is it the funding component and having restrictions on how you can use your funding? So we're hoping to shed some additional light in that area.
Thank you, Claire.
So, Vicki, you're sharing. APHA will also have a One Health session during the main conference, and this is fairly new. Do you want to share more about that, Vicky, or just want it to be read?
I have nothing really to add. I was just sharing. I was just
Great.
respond. I tend to write a lot in the text
That's
chat, so
beautiful. That's
you
great.
can just ignore me.
No, no, it's great. I'm going to monitor the text, but it's great. I want to, highlight what people are sharing, so that folks take in all the resources that are available in this talk for sure. Um, Anybody else have questions or comments or advice that you want to give to anybody else or to the T or the Program for Pet Health Equity? Other comments? Okay. Looks like a lot of enthusiasm at AFA for the public health and the pet perspective. Hi, Jolene, you have a question? Go for it. Do you want to verbally say it, Jolene, or do you want to put it in the chat? We've got about a few minutes left for sure. Let's see. Where are you, Jolene?
If everyone just take a second and put into chat what industry you're representing, what profession are you representing?
Can you hear me now?
Yeah, sure can, Jolene.
Okay, thanks. I put this in the chat earlier and it wouldn't send and then it disappeared. I have a couple of questions about working with shelters. I sometimes volunteer with some of the local shelters for the unhoused, and a number of the participants do have companion animals, all dogs. Um, and one of my questions has to do with the they bring the dogs into the uh, food service area and the dining room, and they always claim that they are service animals, although I've never seen one with any credentials, and apparently the staff just accept what the participants say and don't question it. And I've spoken with people in the health department without disclosing locations because I want them to take an educational rather than an enforcement approach in dealing with this. So I think that has to do with education of staff at the shelters. The second question is I've been disturbed to see the way that some of these participants attempt to manage the behavior of the dogs. I've seen physical abuse hitting them. And I've even spoken to one of the participants who I know really loves his dog, but I think that was just the way that they're socialized, and it's sort of like people who spank kids and insist, despite the evidence to the contrary, that it's appropriate and effective. So I'm wondering about what work is being done or could be done dealing with that.
Thank you, Jolene. First question was about service dogs. That one is to my heart because I have a service dog. His name is Chance. He was trained for 18 months before I was placed with him. And then I had to train with him for about 7 weeks before we could be partnered. So I understand from a different perspective many of the frustrations when someone walks in with their service dog. And service dog is acting crazy and causing conflict. A true service dog, you will never know is there. Every time I leave anywhere, everyone is constantly, I didn't know you had a dog. You're not supposed to. They're not there for you. They're there for me or their partner. And so just they don't have behavior problems. They're trained to do their job and they love their job and they're really good at it. They take it very seriously. When Chance puts his vest on, he knows he's ready to work. So a lot of that is educating folks in what is acceptable and what is not. We have no federal regulations that say a service dog must do XYZ. You're only allowed to ask a couple of questions to service dog partners. And so a lot of folks, like you say, they just don't know. So I would send them to the Americans with Disabilities Act for our government site, service animals. They have a ton of resources listed there. They're not required to wear jackets. They're not required to do a lot of things, but we put them in jackets because it protects them a lot of times from those unruly fake service dogs, if you will. So that's just educating folks on what they are and the differences between emotional support animal, a service animal, a therapy animal, things like that.
So Tia, I'm going to pause us. I'm going to pause us for 1 minute. It's 1 o'clock. I want to thank everyone for coming to this One Health Initiative presentation. Jolene, I'm going to mute your, yep, because if it's a little bit loud, I'm going to mute you. Thank you all so much for coming. Please hang around because we have another answer that's coming in a second. But if you need to go, we just want to say thank you. I love T said, I hope everybody will put their information in the chat so we know who was here. And I hope to see you next time. And then T, if you're willing to stay a little longer to keep answering the question, that'd be awesome.
Sure. And Claire, you may want to chat in on that as well about the behavior aspect and how I know that we've talked in our meetings too because of a lot of I started a program here called VPHO, Vets for Pets of Homeless Owners, and we go out once a month and help those pets and their people. And so that bond is strong. A lot of those families aren't going into housing because they can't take their pet, their other family member. Those attachments are strong, and that really gives you an example of that human animal bond. But a lot of times, again, like you said, Jolene, that's just the education and knowing how to treat animals, how to read them. They tell you what they want you to know. We just don't pay attention. And so a lot of that is learning behavior of that species so that you can better help your fellow staff or the fellow folks who are coming in and needing services. Claire, did you have anything to add to that because it's behavior? No, I think
Well,
she.
I also was I don't know if this pertains directly to Ms. Jolen's question, but we do see a lot of times, you know, animals maybe having a service vest, and there is question about whether they're a service animal, and same thing with ESAs. So I know that's kind of been a hot topic as well. Um, and particularly pertaining to housing and I think the underlying issue really is, well, people will do whatever they can really to be with their pet. And so if that means they register their pet as or claim their pet to be ESA or service animal, we would probably argue that we need to address like why this housing situation or why this place is not pet inclusive, and why people feel the need to maybe misrepresent their animals such.
Yeah. Thanks, Claire. Well, hopefully that answered your question, Jolene. Thank you all so much for coming today. We really appreciate your time, and please reach out to us. If you have any other questions or comments or concerns, please let us know. This is the only way we can make things better is by working together. So, namaste.
Thank you, everybody. And thank you so much, T. So much appreciate your words and work.
Thanks, everybody.
Bye.
Bye.